So let us continue Nash Therapeutics study streak for today. And there is an interesting thing about why we should study the same remedy with the same set of symptoms mentioned by different authors. And if I was reading Cheridonium today, and if you read Cheridonium, there is nothing new in the remedy mentioned by Dr. Nash in his book Leaders in Homeopathic Therapeutics, except that it's a repetition of what has been told by other authors whom we have already read. The benefit of going over Nash Therapeutics, or in that case, any other materia medica, also will be that we can memorize the symptoms again and again and again and again. And that is what our purpose for studying the materia medica should be, that it should be hammered so often that it gets inculcated at the deepest layers of our mind, and we can pick up the remedy immediately as we see them in the clinic. So, we are going through Nash Therapeutics study streak, and the remedy that we'll pick up today is Cheridonium. So, what has Dr. Nash mentioned about Cheridonium? Center of action, liver. Characteristic symptoms we all know from the materia medicas that we frequently refer, especially Allen's keynotes, Boric, or whichever materia medica we have been referring. Fixed pain, or it is a dull, sharp type of pain under the lower angle of the right scapula or the shoulder blade. And it is often indicated for symptoms which is, jaundice, cough, diarrhea, menses, loss of milk, exhaustion. Name any disease, it will probably in 80% of cases have this symptom. This is what Dr. Nash tells us from his experience and from the cases that he has seen. Chelidonium is a remedy like lycopodium. Everything on the right side is affected. So if you'll have a patient who will tell you that my right joint is affected, patients will come to you and tell you a predominant symptom affecting them. In the Materia Medica, we read the symptoms in a systematic order, from the head, from the eyes, from the face, then upper limbs, chest, and respiratory and gastric and genitourinary and generative organs and lower limbs. But what happens in the clinic is that we see the patient telling about scattered details of the symptoms. And if you are sharp enough, you will be able to connect the dots. So, we all should know how to connect these dots. That is the secret in homeopathic practice. Right sided remedy like lycopodium, chelidonium has been mentioned by Dr. Nash. Right sided supraorbital neuralgia, right hypochondrium, scorbiculum cordis is tense, a part of an abdomen which was earlier called with these terminologies, painful to pressure, right sided pneumonia, right sided shoulder is painful, shooting pain in the right hip extending to the abdomen. And apart from all the right sided affections, there is one peculiar symptom, and this also you will find only in clinical examination. So, what you learn by referring Dr. Nash's therapeutics is that he gives us some symptoms which are only and only possible for us to elicit or get to know by examining the patient. For example, in Kalika, you will examine the entire patient, he'll be normal. But as soon as you touch the feet, he will be startled or he'll have a jerk. Similarly, for aconite and belladonna, you will find that dry heat and perspiration will be there respectively. Similarly, for chamomilla, you will find that one hot cheek and other is pale. Same is with pulsatilla, one-sided symptoms, only one-sided perspiration or one-sided coldness will be there entirely. So that is the peculiarity of all the remedies, specific peculiarities, and you will be able to find these only on examining the patient. Patient may not come and tell you that my right foot is cold, give me chelidonium. You have to examine and find out, and the best physician who will win in the homeopathic practice is the one who examines the patient. You can't just sit back and be laid back and take all the history sitting in one place. You need to step in and examine the patient and auscultate, palpate, and see the temperature of the body. Sunstroke. I 2 days back I had a case of sunstroke. I examined and she was cold as ice. Veratrum album straight away set the case all right. If it was not the examination, I would have preferred to give gelsemium. So you will have to get in the field, in the battlefield, and examine the patients. And for chelidonium, Dr. Nash gives us exactly same peculiar symptom which we saw in the other remedies I described. Right foot in chelidonium is cold as ice and the left foot is natural. So you will have to cross check this with the patient or with the relatives and confirm this also. Next is Cheridonium is very similar to Lyco in many aspects, and he says that in some of the cases infrascapular pains may not appear, but the liver region is sensitive. There is a pressive pain in the liver region. It is enlarged and sensitive to pressure. There is bitter taste in the mouth. Tongue is thickly coated. Red margins are there, and the tongue shows imprint of teeth. It gives us a memory of Merksol. But over here, the seat of affection also here is in gastric. Of course, in Merksol also it's a very specific remedy for jaundice, as per Dr. Nash and Gunsi and Herring. So in Chelidonium, he says that loss of appetite, disgust, nausea will be accompanying symptoms, and the other characteristic symptoms he mentioned, which will guide us to prescribe Chelidonium. In Merksol, you will, if you go back and read Merksol, you will see that there is more or less a salivating or kind of a wet tongue, which you will find out. Here, the tongue is thickly coated. These are the nitty gritty things about the materia medica that you will be able to pick up very easily, and they are directly visible to your naked eye. You need not ask, you need not interpret, you need not change any symptom. It's there in front of you. So examine the patient and find out the peculiar objective symptoms, confirm them, and you will hit the bullseye with your remedy. Chelidonium, Dr. Nash tells us that if it is a chronic case, Lyco will have to be called in to cure the case. But you will have to go back to Chelidonium to keep the patient for permanent cure. Lyco may help as an intercurrent, or it can kind of complement the action of Chelidonium. And Dr. Nash tells us in the end that whether it is simple congestion or inflammations of the organ to more severe conditions like fatty liver, gallstones, etc., etc., Chelidonium is bound to cure all such cases which have deep pathologies. Go by the indications given by the masters, and we will never falter. Don't interpret the symptoms, that will Be like a lottery ticket that you are aspiring to win. One in million cases do win, but not all cases. So that's the end of today's session. Follow Homeo Setu WhatsApp channel, Instagram, Facebook, YouTube, all the social media channels, and you will enjoy a very good learning in 2025.